السلام عليكم، ازيكم عاملين إيه؟ How are you؟ أهلًا يا غازي، أهلًا ريان، عليكم السلام، دايمًا يا رب، أهلًا، أهلًا يا أمواج، حنان، عاملين إيه تمام؟ نبتدي والّا نستنى شوية الأعداد تكمل على الأقل or we will start؟ يا رب يا غازي يا رب، دايمًا. السلام عليكم. يلا نبدأ. بسم الله الرحمن الرحيم. What do you mean? Yes. Hello, Abdul How are you? دايما يا رب. سلامة المرضى. ايه معنى سلامة المرضى، او يجي في دماغكم ايه معناه سلامة المرضى؟ What do you mean when I will told you patient safety? Hello. خطوات أعملها في المنشأة عشان أحافظ. أيوة يا سلام عليك. من انتقال أي عدوى أو حصول أي مشكلة. Okay, thank you عبد المجيد, thank you. البيشنت سيفتي هو إن إحنا نقلل أو نحد من المخاطر اللي المفروض بتبقى موجودة في المستشفيات أو في مراكز الرعاية الصحية إلى الحد الأدنى المقبول، إن إحنا نقلل من المخاطر دي الغير ضرورية اللي بتحصل في المستشفيات إلى الحد المقبول اللي إحنا نقدر نتقبله يعني. تمام. patient safety نقلل أو الحد من مخاطر الضرر الغير ضرورية المرتبطة بالرعاية الصحية للحد الأدنى المقبول. As we talked before about the safety culture, in infection control. Now we will talk originally. The safety culture of an organization is comprised of value, attitude, perception, competences, and behavior which determine the commitment to and beneficiary of an organization health and safety management. An organization safety culture is characterized by communication found on mutual trust, by shared perception of the importance of safety, and by confidence in the efficacy of preventive measures. يبقى ثقافة السلامة احنا قلنا قبل كده إنها بتكون عبارة عن القيم والمواقف والكفاءات والسلوكيات اللي بتحدد الالتزام بكفاءة إدارة الصحة والسلامة في المنظمة بتاعتنا أو في المستشفى. لازم يبقى فيه تواصل وكوميونيكيشن دايما بين all healthcare giver or all healthcare provider. بتكون قائمة على mutual trust الثقة المتبادلة. The outcome of this effort may be reflected positive or negative. ممكن الجهود اللي بتحصل دي تنعكس إيجابا أو سلبا. الكالتشر دي لو culture صح يبقى أكيد هيكون positive in our organization. لو الculture غلط يبقى negatively، وهنخسر كتير يعني في المنظمة الصحية بتاعتنا. How we will assess our organization about the patient safety culture. All healthcare organizations should periodically assess where the organization is in terms of their patient safety culture. المؤسسات الصحية بتاعتنا كلها لازم تقيم نفسها بشكل دوري من ناحية ثقافة السلامة الخاص بالمستشفى بتاعتها. The culture of an organization impact the culture of the organization. An organization that has a culture of fear of repetition. ثقافة إن إحنا ما يبقاش فينا ما يبقاش في المستشفى بتاعتنا ثقافة الخوف من الانتقام، أو ثقافة اللوم، أو ثقافة إن الخطأ أصلا من البشر. The IOM Institute of Medicine in USA, they told the ear of human البشر خطائين. And previously we have in our hadith also، يعني عندنا حديث برضو عن الرسول صلى الله عليه وسلم إن كل بني آدم خطاء. وفي ريسيرش حديث من كلية الطب في أمريكا قالت برضو the ear is human، البشر خطائين. فالمفروض ما يبقاش عندنا culture فيها fear of repetition or the mistake from the individual. No, the mistake in healthcare, it should be from the system, not individual. For example, we will not, what is that? Sorry. We will not be very open to reporting error or potential error. لما يكون عندنا fear of repetition, all healthcare or medical staff they have fear to report any error. The organization with a just culture where it's recognized that reporting error lead to process change. لو عندنا ثقافة العدل أو الثقافة العادلة just culture، يبقى كده المنظمة بتاعتنا sure it will change and it will be improved. And it will lead to process change, not individual repetition, has a better patient safety culture. The safety culture assessment help identify and measure conditions in healthcare organizations that lead to adverse event and patient harm. لما نكون مطبقين ثقافة السلامة في المستشفى بتاعتنا هتساعدنا في إن إحنا نقدر نحدد ونقيس نقيس ظروف المستشفى بتاعتنا أو المؤسسة الصحية بتاعتنا اللي تؤدي إن يبقى فيه تقارير عن الأحداث السلبية أو أي إلحاق ضرر بالمرضى. The assessment diagnoses the current safety culture and track change over time. Here also we will know if there is any change in our organization, healthcare organization, by implementing the safety culture. Okay, it raises patient safety awareness, help prioritize quality strategy, and provide an opportunity for internal and external benchmark. Here also it will be increase about awareness about the safety culture and will help us to be prioritize quality strategy in our healthcare organization. And we will have a benchmarking, internal or external benchmark. The survey is the baseline from which action planning and system process change can be being. Here also, like we told before, people can and will make mistake. They will not stop to do the mistake because we all are human. Ear is human. It doesn't matter who that person is, what they do for a living, or how much they are paid. We will make mistake most of the time. The mistakes are not premeditated errors. يعني دايما الأخطاء كلها مش بتبقى مع سبق الإصرار. في 3 أنواع هنتكلم عنهم later on. الإنسان خطاء، بس في بعض البشر بيكون بدون قصد، والبعض بيكبر دماغه، والبعض بيبقى قاصد إن هو مش قصد، يعني إن هو بيبقى عارف الحل الصحيح لكن he is doing error also. But as we know, it's from the system, not from the person himself. The healthcare system, based on the type of work that is done, must attempt to eliminate as much error as possible for its culture. احنا كمنظمة صحية لازم نحاول ان احنا نقلل من الأخطاء دي، ونقلل من ثقافة اللوم عشان يبقى في إبلاغ عن الأخطاء أو الأضرار المحتملة إنها تحصل. In a just culture, all employee, practitioner, and other understand that the mission and vision of the organization guides them to do the best that they can in completing their job. In our organization, when we will start the strategic plan, the first thing we will do the mission and vision and our value. The mission and vision, it will guide the employee and practitioner to do the best they can in completing their job. Just culture is obtained and organization where everyone know the company's value and how they are expected to make choice to protect those value. For this reason, all also in healthcare organization, all medical staff, even not medical staff also, they should know the mission and vision and value of their organization. عشان نطبق ثقافة السلامة أو ثقافة العدل في المستشفى بتاعتنا. احنا عرفنا دلوقتي ان الثقافة العادلة دي lead the patient, the employee and practitioner to do the best of they can completing their job عشان يقدروا يعملوا الأفضل إنهم ينفذوا الوظيفة بتاعتهم في مكانهم. طب إزاي؟ أول حاجة أول ما نبدأ إن إحنا نعمل خطة استراتيجية للمستشفى بتاعتنا يبقى عندنا الرؤية والرسالة والقيم بتاعت المستشفى بتاعتنا. ومن معايير سباهي بالنسبة القيادات أو القيادة العليا أو الإدارة إن يبقى هم مؤسسين الميجن والفيجن والفاليو. طيب إيه دخل الإمبلوي أو الستاف في الموضوع؟ No, they should have training about it. They should know what is their mission and vision and the value in their organization. لازم يبقوا عارفين الرسالة والرؤية والمهمة والأهداف بتاعتهم في القيم والأهداف بتاعتهم في المستشفى. And I prefer also it can be like card for all staff. يبقى مكتوب في كروتة كده صغيرة للإستاف كلهم إنهم يبقى عارفين الرسالة والرؤية والقيم بتاعتهم في المستشفى، ويبقى فيه دورات ومحاضرات عن إزاي يبقوا عارفين الميجن والفيجن والفاليو والشرح وإن أقل شخص أو مش هنقول أقل شخص إن يعني أقل position he lead the organization to be the best also, even the housekeeper, even the cleaner. From the mission and vision and value, we should tell them they are also lead the organization to be the best. Okay? Everyone had a job to protect the patient and other and to be a part of the solution to reduce the risk of error. As we told also before yesterday about who's responsible for infection preventing in the healthcare organization. Here also, who's responsible for patient safety in our organization. مين المسؤول برضو عن سلامة المرضى في المستشفى؟ احنا امبارح سألنا نفس السؤال عن مكافحة العدوى، النهاردة عن سلامة المرضى. مين اللي مسؤول عن سلامة المرضى في المستشفى؟ محدش يقول لي أهلا وسهلا يا عبد الرزاق. welcome. مين المسؤول عن ثقافة عن سلامة المرضى نفسها في المستشفيات؟ Who's responsible for patient safety in healthcare organization? خدمة المرضى. What you mean about خدمة المرضى يا عبد الرزاق؟ مين يعني قصدك تجربة المريض الحاجات دي؟ قسم تجربة المريض مثلا؟ Okay, thank you. Excellent. Yeah, it can be also. قسم الجودة وسلامة المرضى. Yes, عبد المجيد. Thank you. Excellent. All healthcare giver, they are responsible for patient safety. Policy and procedure, they will do all process about the quality and patient safety. But who's responsible in our healthcare organization? All caregiver. Thank you عبد المجيد. كل مقدمي الخدمة الرعاية الصحية أو كل الأفراد أو كل الإستاف في المستشفى مسؤول عن سلامة المرضى، مش قسم الجودة وسلامة المرضى بس، مش قسم مثلا قسم الخدمة الاجتماعية، مش قسم تجربة المريض أو خدمة المرضى. هو كل الأقسام دي طبعا داخلة في الموضوع، بس for all healthcare organization and all staff and all employee, all practitioner, or healthcare giver, all healthcare providers, they are responsible for the patient safety in our organization. Here, everyone has a job and they be a part of the solution to reduce the risk of error. Most serious medical errors are committed by competent caring people. Doing what other competent caring people would do. See, here are the more medical error from the competent person. And they are caring people doing what other competent caring people would do. They know already their job, but they have error. Here we will talk about the Swiss cheese also for the error. It has been identified that most errors are a result of a process and not necessarily the individual, as we told before. The process somehow enable mistake to happen. Even the process also, it enable to mistake. It enable to happen this mistake. The Swiss cheese model demonstrated that errors don't occur in the isolation, but are associated with a number of smaller errors leading up to the catastrophic error. نموذج اللي بنسميه نموذج الجبنة السويسرية للعالم جيمس ريزون. هو عمل النموذج ده والفكرة بتاعته إن الأخطاء الصغيرة ممكن يؤدي إلى الخطر الكبير. الفجوات أو الفتحات الصغيرة هنا اللي موجودة في السويس تشيز، it's the smaller error lead to be big error or catastrophic error. Sorry. Here the behavioral choice in just culture. We have 3 behavior: human behavior, at-risk behavior, reckless behavior. Sorry. The human behavior means also human error. أنجبت له 5 أطفال. At risk behavior ده عبارة عن سلوك اللي احنا قلنا سلوك متعمد. reckless behavior بيبقى فيه change في المنظمة بتاعتنا، بس كل الناس اتغيرت ما عدا بعض الأشخاص مثلا بيقاوموا التغيير ده أو بيتعمدوا إنهم يتجاهلوا التغيير، تجاهل، أو متعمد إن هو يرفض اللوائح، ده reckless behavior. And each one we have the solution or how we will improve that behavior. The human error, the better thing we will do about it, we will ask like 5 whys, why it happened. Because we told before the errors in organization, not personal or not individual, it's system. We should make root cause analysis about it. When we have any human error, we should have root cause analysis. That is the solution about the human error. The at-risk behavior, here we will do coaching to increase the situation of awareness. Because the error here from the culture, not from the human. Reckless behavior, the solution here, it should be punish. But we prefer in patient safety, there is no punishment. But when the person, he know the mistake and he did, we should have punish to this person. Okay? Human error, which is inadvertent action, a lapse or mistake, or a mistake, is the first behavior choice. When human error is made, the individual should be consulted regarding the mistake. The process should be examined and managed through changing the choice, process, procedure, or training, and so forth. An example of this may be starting an operative procedure without a time out. خطأ بشري، human error، قلنا عليه إن هو غير متعمد، زي المثال هنا in time out، إن إحنا ممكن ننسى إن إحنا نعمل نبدأ الجراحة بتاعتنا بدون time out. At-risk behavior, with this behavior, the individual choose to do something that may unintentionally lead to the situation where harm occurs. The person doesn't necessarily recognize the possible risk and result of their action, or feel that the risks are insignificant or justified. هو مش بيكون مدرك أصلاً إن في من السلوك اللي هو عمله أو من البروسيس اللي هو عمله إن السلوك ده ممكن يعرضه للخطر أو النتائج بتاعته المحتملة إنها تؤدي للخطر. يعني here the example of the risk would be looking a billboard while driving a car. يعني مثلا نبص للوحة معينة أو ننشغل مثلا في التليفون إحنا وبنسوق العربية. at risk behavior، هو مش عارف نتيجة الخطأ ده ممكن يحصل فيه إيه. With this behavior, the individual should be coached as to consequence of with where we stop the consequence of the action, and that better choice should have been made. The organization should remove incentive for at-risk behavior, incentives incentivize healthy behavior, and increase situational awareness. هنا المستشفى بتاعتنا أو المنظمة لازم تحفز السلوك الصح ونعمل زيادة للوعي by coaching بالتدريب، ونفهم الأشخاص إن عواقب النتائج المحتملة للسلوك بتاعهم ده ممكن يؤدي إلى أخطار أو harm for the patients. The third one, reckless behavior. The dangerous behavior or dangerous error here with patient who has reckless behavior. The individual consciously choose to put themselves or other in harm's way. The risk is identified but is ignored. بيبقوا عارفين المخاطر أو النتائج اللي هتحصل بس they ignored. بيتجاهلوا الموضوع ده. It is with the type of behavior that there should be severe consequence related to the behavior, such as remedial action or punitive action. As I told before, they should have punitive action for who has reckless behavior. Because they already consciously choose that behavior. Now, to achieve just culture, the organization must have reasonable value and expectation, knowing that there will be mistakes made. The ear is human. There must be good system design. لازم يبقى فيه نظام جيد أو system جيد أو process جيد عشان نقدر نكتشف بيه الأخطاء اللي بتحصل في المؤسسة بتاعتنا واللي بتعطل نظام الشغل بتاعنا. That catch and recover from human error and equipment failure. The company must direct and manage the behavior choice, the company or the organization, the healthcare organization, of its employee, practitioner, and so forth, as described above. Also, there must be learned system in place to allow the organization to learn from the error that occur and make improvement in process to prevent further mistake from occurring if possible. We should learn from our mistakes. We should have learning system in our organization to know what it happened as previous errors. The organization must treat every individual and event with accountability and justice. There must be an unbiased and fair manner utilized regardless of the severity of the error. لازم يبقى فيه ثقافة العدل وما يبقاش فيه تحيز مثلا لمنظمة معينة، لقسم معين، لشخص معين، ونتعامل مع الأمور كلها بتحيز وبحزم لو في أخطاء حصلت يعني. في بعض الأدوات اللي بتستخدم في المنظمات بخصوص موضوع إن إحنا how to learn, how to make system learning, like establish learning board. لوحة التعلم، لوحة كده بتتعمل مثلا في الأقسام أو مثلا يعني مثلا كمثال إن إحنا نعملها في قسم الجودة، لوحة بتعرض المخاوف اللي بيتعرض ليها البراكتيشنر or health care giver، ودي ممكن نعملها عبارة عن كروتة أو أوراق كده صغيرة تتكتب، وكل موظف يجي يكتب مثلا إيه المخاوف اللي ممكن بيبقى جواه لو هو حصل خطأ، أو قالوا له بلغ عن أخطاء، أو مثلا قالوا له OVR. أول حاجة هتيجي في بالنا أول ما حد يقول لك أنت عندك OVR، أنت حصل معاك، كتبوا عنك OVR، كتبوا عن القسم بتاعك OVR، إيه المخاوف اللي هتحصل في الموضوع ده؟ أفضل شيء، أفضل طريقة when we have OVR we should not be fear, we're not feeling fear because it's for improvement, not for individual, not for punishment, to learn from our mistake. Even near miss we should have OVR because near miss lead to be sentinel event. The establishment learning board tool that can be used on unit is learning board. Unit or department or the with teams as they like in your organization. The learning board is posted on the unit and utilized to display safety concern identified by staff, practitioner, and other. It's up to each organization as to where this learning board is displayed. As I told before, department in quality and patient safety department, in your specific department, between the teams, between nursing, like that. And those determine if patient and or other may also view the board. Even the patient, they can share with us about the what they have safety concern. Any person may place safety concern on the identified section of the board through staff meeting, leadership, walk around, and other such activities. The prioritization of the safety concern is determined and the appropriate individual assigned to each initiative. Yesterday, we told also about something we can do like this learning board. What we have in quality improvement program yesterday, before yesterday, when we have program or improvement project, we have something same this established learning board. في حاجة اتكلمنا عنها في المحاضرة بتاعت أول امبارح الكواليتي امبروفمنت انيشيتيف، شبيهة للليرنينج بورد دي. هنا الليرنينج بورد عبارة عن قلنا زي ما قلنا تبقى سبورة كده معينة بيحطوا فيها كروتة أو أوراق صغيرة، نوتس صغيرة، كل موظف، المرضى، أي حد في الأقسام يكتبوا المخاوف بتاعتهم عن السلامة أو عن الأخطاء أو عن إن هم يبلغوا عن الأخطاء دي. يعني معناه إن هي عبارة عن أفكار بتطلع وبتتحط على النوت ده في القسم مثلا في حاجة شبيهة عملناها في البروجكت improvement the before yesterday. الناس اللي مركزة معانا عبد المجيد، عبد الرزاق، هيا and كله يعني ياسين، أمواج، كلكم. في حاجة شبيهة للlearning board دي اتكلمنا عنها before yesterday about the improvement project. في حاجة شبيهة كده بنطلع فيها أفكار برضو لما عملنا البروجكت مشروع التحسين للفاب، الالتهاب الرئوي التنفسي اللي من الأجهزة من التنفس الصناعي. like what؟ فاكرين ولا نسيتوا؟ tools بنطلع فيها الأفكار بتاعتنا لما عملنا الأورجانيزيشن تيم. يا هيا أنت كنت معايا وجاوبتي على الموضوع ده. when we organize a team we have tools to put all idea in the project. Did you remember about it؟ طيب learning board زي brainstorming. احنا قلنا في tools بنستخدمها when we organize the team when we are doing the improvement project. We have collect all ideas from the team. It means brainstorming. Same, collecting idea. Here also learning board, they are posting all display safety concern. It's the same like notes, and there is other tools also. It's named affinity diagram. Also they put cards to make all ideas. Okay, got it? A designed individual on the unit is appointed to aggregate the data and to report the data to appropriate individual. يبقى في شخص معين هو اللي بعد ما السبورة دي تتملي بالأفكار والبوستس about the fears about the safety concern، يبقى في شخص معين هو اللي بيعمل كولكت للداتا دي كلها، وبعد ما يعمل لها كولكت وتحليل هيبلغ بيها الأفراد المناسبين على حسب مثلا في مخاوف مثلا من قسم كذا، في مخاوف من أشخاص كذا، مش أشخاص ده أشخاص يعني department or units like that. بعد ما يجمع البيانات دي he will report to appropriate individuals or persons or department or units. Okay, the learning board promotes visibility of specific concern and what is being done to resolve the concern or issue. اللوحة دي بتعزز رؤية اهتمامات محددة بيتم القيام بيها عشان نحل المخاوف أو المشكلات اللي يتكلموا عنها all the staff or practitioner or even the patients. This transparency demonstrates to the staff and others that their input is critical to having a well-functioning patient safety program. من لوحة التعلم دي برضو هيعرف الأفراد individuals or staff or practitioner they will know there is a well-functioning patient safety program. إن في برنامج سلامة مرضى بيعمل بشكل جيد في المنظمة الصحية بتاعتنا. Being able to anonymously بيكون بطريقة مجهولة، يعني مش بنكتب فيها أو بنحدد فيها قسم أو بنكتب فيها أشخاص معينة، بتبقى مجهولة. report concern in this manner may be valuable for the staff and other to report the safety concern without fear of reprisal. عشان ما يحصلش خوف من الانتقام والكلام ده، أو إن هو مثلًا يبقى الموضوع هيبقى شخصي، فلازم يبقى مجهول، ما فيهوش أسماء. تمام؟ Patient safety and leadership round. It's so important we have leadership walk around. Patient safety leadership round or walk around was developed by في عالم اسمه ألان فرانكل to increase awareness of safety issue by all clinicians. عشان نزود الوعي لازم يبقى في جولات للإدارة أو القيادات العليا في المستشفى بالنسبة للأقسام، بالنسبة لليونتس، بالنسبة الأقسام والوحدات ER, OBD, all departments they should have walk around. The walk around occur in patient care area of the organization and demonstrate to staff that the organization is committed to patient safety. Here also patient safety and walk around from the leadership. Here we will know also there is a committed to patient safety. Our organization is committed to patient safety. Here also the transparency demonstrate here we will tell the transparency and walk around. Now we will know it's our organization, they are committed to patient safety or not. Okay, the walk around also provide an informal method for leader to talk to staff and encourage reporting of error. When your leader already know about the patient safety and he committed the patient safety, sure your staff, all staff in the organization, they will lead to be report about all errors in the organization without fear. Okay, the first one he will be lead to committed the patient safety, the leader, our leadership in the hospital or our organization. And they will encourage reporting of error as well as reporting to staff the accomplishment of the organization in elimination or decreasing the effect of the error. اللهم صيبا نافعا يا رب. Here we have many objectives of patient also leadership walk around. Increase awareness of safety issue by all clinicians. Engage senior leadership with frontline staff about patient safety issue. هيزود الوعي ان جميع الاقسام الطبيه او الستاف ان هم يقدموا او يبلغوا عن الاخطاء، يبقى عندهم وعي بيها. هيشاركوا الموظفين بتاعتهم ان هم يتكلموا عن او يكونوا الخطوط بالنسبه للخطوط الاماميه الفرونت لاين like nurses in ER مثلا، هيشاركوهم بخصوص قضايا سلامة المرضى. Provide opportunity for leadership to openly discuss operational failure, safety and harm from frontline staff. هم بمناقشتهم للفرونت لاين ستاف هيقدروا يتوصلوا يعني ممكن أفكار جديدة هم مش في دماغهم، هيقدروا يوصلوا للأفكار الجديدة دي عن طريق الفرونت لاين ستاف. And when they share them or engage that issue also with the frontline staff. The objective also educate staff about patient safety concepts such as just culture, encourage frank and open discussion in a unit setting, obtain information collected from staff about barriers to safety, assure the information collected affect action or resource allocated. Utilize the learning board also. Elect information that can be collected and aggregate in a useful manner. The walk-around cannot simply start without preparation. When we have walk-around in our organization, we should talk before with the department. We should call the senior of the department, that the leader, they are coming to check, they are coming to see your department, and not any time. Okay, sometimes morning shift, they are so, sometimes yani, as example, the morning shifts, they are very crowded. That is not the time to make walk around and ask the frontline staff, because they are already busy, especially when they have too much patient. That is not the time to talk about anything. They are carrying the patient already. Walk around cannot simply start without preparation of senior leadership and unit participant. The leader must have buy-in with the concept and agreement of the need to be consistent with the walk around. The walk around should consist of senior leadership, ascribe the patient safety officer or quality professional and manager director of the unit. The team, they will be walk around with the leader, the first, the senior leader, and scribe, because he can write, and even sometimes they will make videos or photos about this walk around, and patient safety officer or quality leaders or any person from the department, and direct of the unit. The scribe capture comment, concern, and safety event. There must be a plan to provide feedback from the round to other leader of the organization. Here, as we told, it should be the walk around scheduled. It's common knowledge that the nursing staff are based at certain times during the day, depending on the type of unit or department. This I told also before. The staff nurse, they are busy at a certain time. No need to be walk around. The first thing in the morning is not good time for round due to the patient care that must be accomplished in the morning or after shift change. والوك راوند لازم ما يبقاش مثلا في شيفت معين، او عشان الاداره موجوده او القياده العليا موجوده، لازم يبقى في كل الشيفتات. Sometimes in night shift there is no leader even, then there is no walk around. No, they should have the beauty of a leader or something like that. They do the walk around. It should be in all shifts, not in one shift, okay? Because as we told, the first thing in the patient safety, the transparency. In all shifts, so that all staff members have opportunity to voice their concern and have buy-in with the process. هيقدروا يعني لما يكون الوك راوند او الجولات اللي بتحصل من الإدارة أو القيادة تكون في كل الشفتات، ما تكونش في شفت واحد معين. ولو ما فيش مثلا إدارة بتبقى موجودة أو القيادات أو بعض الأقسام زي ما قلنا مثلا ما فيش at night patient safety and مثلا department، أو بعض الأقسام اللي هتبقى في التيم بتاعت الوك راوند they should have the beauty of the department. لازم يبقى في حد بالنيابة ويعملوا الوك راوند وكل حاجة تتسجل وتبقى مكتوبة برضه. Everything it should be documented. And to give the staff or frontline staff their voice, like speak up. لازم يبقى عندهم فرصة إنهم يتكلموا، أو إن هم يبقى عندهم الليدر لما يعملوا الوك راوند they feel، يبقى عندهم مثلا they feel safety also for themselves. They feel encouraged from them. Okay. The walk round should occur weekly for at least a year to reinforce to the staff and others that the commitment from the leadership is not a one-time occurrence. And also I preferred when we are doing the strategic plan, we should write this all steps specific about the walk around, about the training education, also about everything. It's important to written in the strategic plan of the organization. Some organization announce when the walk around will be occurring and other do not. Some organization assign specific leader to a specific unit, department, which can build trust between all who participate. It should be culture, just culture, or we have here like we have Steve, like equitable. There is equitable here, not some organization, not some department and other not announce. They should all same. Okay. The manager of the unit or department should know several days in advance that the walk around will be done on unit or department. When walk around team arrive in the area, a brief opening statement introduction should occur. When the leader they will be in the department or in the unit, they should have brief why they make this walk around and what they mean when they are doing this process in the organization. This opening introduction should be scripted so that all of the senior leader make the same and set the stage for open discussion. Like as I told you before, this when the leader he did something, all the organization they will lead and they will do like the leader. When they have the opening introduction from the walk around, even the senior leader also they will do like them. It's also important for leadership to elicit concern from patient and family during this walk round. مهم جدا برضو إنهم يتكلموا برضو مع المرضى، مش الفرونت لاين ستاف بس، يتكلموا مع المرضى والريلاتيف أو الفاميلي عشان برضو يشجعوهم إن في أمان في المستشفى ويزيلوا عنهم المخاوف بتاعتهم. It's important to take a camera along on around and walk around so that other can see issues. طبعا before قبل ما نعمل الحاجات دي يبقى في policy about it، يعني يبقى they should know about what they will do in all the departments. They should have camera also to make open discussion and عشان يعرضوا الدiscussion ده مثلا في training أو في محاضرات بعد كده للأقسام التانية. من هنا هنقدر نوصل لمبدأ التعلم في المنظمة بتاعتنا، أو التعلم من الأخطاء أو التعلم من الأحداث نفسها. At the end of the season, there should be a script closing statement that indicate that there will be work done to examine the information provided and identify and prioritize the improvement to be made. The participant, they ask to take with other in the unit, to talk with the other in the unit department about the concept discussed during the meeting. It's important also that there's follow-up and they have feedback to the staff about this issue to discuss during what they discussed in the walk around. Regularly safety briefing or other meeting should also be conducted through the organization regarding the issue raised and to communicate what is being done to improve patient safety. This is our reference, and I'm thankful to all. And do you have any questions? Do you have any question about the patient safety management and just culture? What our 3 behavior we have in the patient safety culture, in the patient safety? Any questions? Hello, any question? Did you have any questions? Did you have any question about patient safety management? Okay, can I ask? What do we mean when I will ask you about reckless behavior? What do we mean about the reckless behavior? Hello? عندنا 3 أنواع من سلوكيات ثقافة المرضى اللي قلنا عليهم. إيه هي ال3 سلوكيات اللي ذكرناهم في المحاضرة؟ We have 3 behavior in patient safety. human behavior or human error, at-risk behavior, and reckless behavior. Okay. Thank you. I will start the other. You have any questions, please, before starting the other lecture? You have any questions? Okay, thank you, Hanan, Magid, Tariq. Okay, I will start my other lecture. Here in this lecture, we will talk about how many tips or how many trick or common mistake it's happening from when we are donning and doffing BBE. Common mistake when we donning and doffing BBE. BBE, it's personal protective equipment. Sorry. معلش اسفه على القطع بس المطر شديد جدا فمش عارفه يا رب تكونوا سامعيني كويس يعني. ما شاء الله اللهم صل على النبي. Here the definition of personal protective equipment: specialized clothing or equipment is worn by an employee for protection against infectious material. Already yesterday and before yesterday Dr. Anura talked about the PPE. عايزة أعرف بس إيه هي معنى ال BBE؟ إيه معنى ال BBE؟ What we mean about the BBE and the example of BBE. it's specialized clothing, like here in the slide. Clothing or equipment is worn by employee and protection against infectious material. عبارة عن الملابس أو المعدات أو الأدوات اللي احنا بنستخدمها أو الموظف بيلبسها عشان يحمي نفسه من العدوى أو من أي مواد معدية، مرضى أو الستاف أو موظف. Here OSHA 2014. There's a definition from OSHA. The background: the safe removal of personal protective equipment can limit transmission of serious communicable disease, but this process both challenge to healthcare workers. At the first, what are important points that we consider and focus before donning and doffing PPE? Who can answer about it, please? Yes, حماية من الفيروسات. شكرا يا عبد الرزاق. ايه هي النقاط المهمة او الحاجات المهمة المفروض ناخدها ببالنا قبل ما نلبس البي بي اي او نجهز البي بي اي او نخلع البي بي اي؟ في نقاط مهمة ومحددة قبل ما نجهز اصلا البي بي اي before focusing our donning and doffing PPE. What is the important point, please? We have important points before considering the donning and doffing PPE. Like what? Okay, thank you. Thank you, Majid. Thank you معاد. معرفة حجم الكارثة. بصي، في نقاط مهمة قبل ما أجهز البي بي إي بتاعي، قبل ما أجهز ال personal protective equipment. في حاجات مهمة لازم أعملها الأول. لازم أتأكد من إيه؟ في حاجات أتأكد منها قبل. Yes, thank you, excellent. Yes, excellent. تعقيم مثلا. أوكي عبد الرزاق. Thank you. في حاجات تانية مهمة لازم يبقى إيه؟ expiry date. لا أيوة، ممكن للمعدات بتاعتنا نشوف expiry date، نشوف fit تبقى مقاسنا ولا لأ. Yes, appreciate. Size also. Okay, like thank you ماجد. معاد عبد الرزاق. معاد also expiry date. ماجد thank you. نون yes. النظافة برضو. طب نظافة ايه؟ ان احنا اول حاجة لازم نكون شايلين كل الملحق، يعني مثلا خواتم accessories. اوكي thank you ماجد. yeah. يكون المقاس مظبوط وصح. ما اخدش مثلا جلافز ضيق عليا يتقطع وانا بعمل البروسيس كده already I have infection. هيبقى عندي infection already. لكن لازم يبقى كل fit every size, all size it should be fit to me. Okay, even gown, even my mask when we are when I take inhale and exhale. Okay, يبقى أول حاجة now it's unstable. It's important that there is mirror along with the health practitioner in order to make sure that the BBE is probably worn or that they are with someone to help him. يبقى أول حاجة لازم يبقى فيه عندنا في القسم أو في الغرفة، في طبعا هيكون غرفة معينة اللي احنا بنعمل فيها الدونينج والدوفين بتاعنا، وهنقول عنه هنسأل عنه بعد كده امتى هعمل الدونينج وامتى هعمل الدوفين. يعني الدونينج قبل ما ادخل المريض ولا وانا عند المريض ولا امتى. المهم يبقى عندي في الغرفة دي مراية كبيرة بطول الشخص مثلا، عشان الأشخاص يشوفوا فيها الجاون، بالذات الجاون وهم بيلبسوه، عشان لازم يبقى fitted or closed well from the back. أو يبقى عندي شخص تاني معين help me to see my gown it's closed properly or not. Okay, this is the first one. المهم عندي إن احنا يبقى عندنا في مراية في الغرفة، أو يبقى في شخص تاني واقف معايا يشوف مثلا أنا لبست الجاون صح ولا لأ. The second, take off all your accessories, watch and nail polish. It's important to cut nails also. لازم أشيل كل الأكسسوارز أو الساعة اللي أنا لابساها، أو مثلا لو عاملين مونوكير، أو إن إحنا نشيل نبقى قاصين الضوافر بتاعتنا، لأن الجراثيم برضو بتدخل بين الأظافر، وإحنا لما نعمل الهاند واش والهاند هيوجين ممكن لو ما عملناش الوقت المناسب ممكن ما يوصلش، ممكن الجراثيم اللي بين الضوافر تبقى لسه موجودة، وكده إحنا هننقل العدوى لأشخاص تانيين. حتى لو خلصنا الهاند هيوجين بتاعنا ممكن نطلع ونروح with our family and we have the grams in between the nails. Okay, here as you told also, select the right PPE based on the infectious agent. Here the على حسب الأمراض المعدية بنختار برضو PPE، لأن ممكن when we are taking blood we have specific PPE. When we are in isolation we have specific PPE. When we are in ER we have specific PPE. When there is anything like blood like airborne and precaution we have special PPE. Okay, we should select the right PPE based on infection agent. Make sure you have been properly fitted and sized for your PPE. During this note also, during patient care, PPE must remain in place and be worn correctly for the duration of work in potentially contaminated area. PPE should not be adjusted during patient care. In the event of significant splash, the healthcare worker should immediately move to the dolphin area to remove PPE. لو حصل أي خلل في PPE بتاعنا لازم على طول نروح منطقة اللي احنا بنعمل فيه الدوفينج ونشيل معدات الوقاية الشخصية بتاعتنا. Donning before contact with done before contact with the patient, infection material. The key point about PPE. Infection material, use carefully, don't spread contamination, remove and discard carefully. Here the donning and doffing. Okay. How to safely use PPE. Keep gloved hand away from face. Avoid touching or adjusting other PPE. Remove glove if they become tear. Perform hand or hygiene before donning new gloves. Also, limit surface and item touch. Now, the first one from the common mistake it's happening, not performing seal check on 95 N95 respirator. This process, it should be done correctly to not be infectious. Okay, and here I have we have video how to wear. I hope it will work. It's not opening. I think there's problems or something like that. In order for N95 respirator to effectively protect the wearer, a seal check must be performed every time it's done. Healthcare providers often rush through the donning process, and some may not realize that the seal check needed to be done each and every time they put on their N95. It's important to make this step seal check in N95 especially, and some stuff they don't care about to do this seal in N95 because of they are hurry, they have too much patience, they won't finish their work like that. They are not carrying, or they are not, or they ignoring to make the seal check in, especially on N95. This likely because many healthcare providers are not accustomed to routinely wearing N95, so this new of them. Also, they are working under strange circumstances and trying to assess a large volume of COVID-19 patients. This before Yani. The seal check involves placing your hand around here. The technique. The seal check involves placing your hand around the respirator as long your face, your hand, it will be like that as your face, then breathing deeply. Take breathing deeply, inhale and exhale. You should check round of your N95 when you have air going or coming or going out. Deeply in and out to ensure air not getting through the seal. It may seem like a rudimentary exercise, but it's effective in ensuring respirator on properly. A demonstration on how performing seal check should be a part of the respirator fit testing for healthcare provider. this we talk about it. That's the first one of common mistake from BBE, not performing seal check. The second one, we have misstep. Here seal check also. The first, like that, then we should put our rubber like that also. Then we will adjust here from this metallic strip. Then perform a fit checking according to the instruction. We should read our instruction. Place both hand over mask. Take a deep breath and hold your breath for a few seconds, making sure the mask collapses inward as you inhale. Then exhale. If there leak, reposition the mask and follow the step from 1 to 3 until tight seal has been achieved. When facial hair or other facial feather may prevent the mask from achieving a proper fit, if a tight seal is not achievable, please don't use this product. Okay, some they have the chain hair and ممكن the mask والناس اللي مثلا عندهم دقنهم كبيرة ممكن الماسك not fit of them when they make the inhale and exhale. There is air already. If you experience difficulty breathing, dizziness, or other symptom, leave the contaminated area immediately. Okay, this all about the seal check. It's the first one in the common mistake. The second one, misstep with a personal or equipment and hand hygiene practice. ممكن إن إحنا ننسى جزء أو بعض الإجراءات في إن إحنا نعمل المعدات بتاعتنا، نجهز المعدات بتاعتنا، أو نعمل هاند هايجين، أو نعمل الهاند واش بتاعنا، أو الوقت بالنسبة للهاند هايجين برضه. أو ممكن إن إحنا ننسى بعض الsteps between the all process because we have too much patient, we have shortage of staff. Sometimes we will miss step our process. They may seem obvious, but it's issue that is still frequently observed. Most are clear on hand hygiene process before donning PPE. However, a lack of proper hand hygiene has occurred in between doffing step and after doffing PPE. This includes not washing hand and as required between doffing step per hospital policy. After leaving a patient room and not wash for at least 20 seconds, healthcare workers need to be mindful that when doffing with PPE, they are touch surfaces that have the potential to be contaminated. The third one, improper storage of PPE that be reused, like N95. Before, when we have too much patient of COVID-19, we will reuse the N95 and some PPE, like our goggles or our face shield. The improper storage for that equipment is a common mistake also for donning and doffing PPE. Its response to supply shortage, like such as N95, It's during the doffing process and area outside the patient room where errors are being made. If N95 is stored for use, it should be stored in a container that is able to be closed but vented to allow moisture to escape. Additionally, like face shield also and goggle are not being properly cleaned and labeled. They should labeled and write your name and cleaned or disinfect your face shield or goggle before making the storage. Okay, this is the third one. The first, layer additional unnecessary PPE more isn't always better. Sometimes we are afraid because when there is COVID-19, we are afraid to be we have grams, we afraid, and we make two like some they are using two mask because they are thinking like that they will be more safety. They will wear the regular mask, then up of this one they will wear the N95 or the N95 then the regular mask. It's so يعني not right. It's wrong also to do, because when you will remove the first one of your mask, it should be there is already contaminated. One of them is contaminated already. Like that, you make yourself more infectious. You have more grams like that. You didn't protect yourself, no. Here, from here, in some cases, too much PPE can be more hazardous than good. For example, some are wearing surgical masks over the N95 respirator. If the user is treating the surgical mask as part of the N95 and wearing it only with the N95, it may not present additional risk. However, the doffing process presents the opportunity for error that can result in cross-contamination. If the user later put the surgical mask on without the N95, there is potential for contamination since in the inside of the mask was touched or touching the outside of the potentially contaminated N95. Okay, as I mentioned before. Also, wearing mask on top of the N95 can make breathing, and it will be hard also for you to take the breath. You have now two errors, two mistakes, not only one. You cannot take a nice breath, and the other one, the one of this mask already is contaminated. That's much more difficult without any real added benefit based on current guideline. Okay, this fourth one, we have 6. There is more too. Limited or inadequate training and support for outpatient safety, outpatient staff. Some departments, they don't have a good training about how to wear PPE or how to make their hand hygiene. The more from the, I think, OBD staffs, it should all the hospital, they have training about hand hygiene and how to wear PPE well. And now I think they are making also training about to know who patient or who has COVID-19 and sometimes they are training the doctors and medical staff about the dengue fever and the Ebola. They are making more training now about this all. As hospital and healthcare organization being to increase amount of outpatient and ambulatory care, it's important to recognize that staff within outpatient and ambulatory care setting are less accustomed to wearing specialized PPE, especially N95 respirator, specialized training and observation-based auditing should be conducted for staff who are wearing an increased level of PPE. In-person based training signs are helpful in this setting, but it's important that training content is customized. The outpatient setting, all too often the training assume an inpatient setting, and there can be important difference such as which PPE to wear, their availability of PPE and storage location. This training, what we will do for the training, which PPE we should wear with the special infections, or the availability of PPE, and how to store the PPE. The last one, culture matter. Opens to input and whether it's to being done right. Healthcare provider will need to look out for each other. يعني الكالتشر الثقافة بتاعتنا في إن إحنا مثلا لو شفت حد من زملائي لابس البي بي إي غلط فيا ريت ننصحه مثلا نقول له معلش يعني الجاون مش مقفول صح. إحنا مع بعض مثلا في القسم already we are in the unit and we have process for our patient, or in unit مثلا the dialysis unit we have process for our patient. We should tell to other when they have any mistake in the PPE. This from culture also. During the donning process, there are no mirror available, so that is an individual can check to make sure they have probably put on PPE also. The use of PPE spotter are less common than during the Ebola outbreak. Healthcare provider may need to rely on other staff to tell them when they haven't done it correctly. You may not realize that your gown is not fully covering your backside, or that your face shield is off center. Your coworker can help. When we have in our organization we have reminder for each and for others like that. We have a good culture and patient safety culture about the infection control, or about the hygienes, about the PPE, how to wear PPE. An environment where it's a part of the process to give and receive correction and helpful, remind to perform an N95 seal check and hygiene or disinfection. And face shield will help safeguard against cross-contamination and possibly transmission of disease. Here I have questions when there is we have this all common mistake, what our hospital or what our organization they should do. What can hospital do to address this issue? لو عندنا الأخطاء دي كلها أو ال النقاط اللي قلنا عليها بتحصل في المستشفى لما بنعمل الدونينج والدوفينج للبي بي اي، المستشفى المفروض تعمل لنا ايه؟ يعني احنا قلنا اول حاجه ان احنا مش بنشيك على السيل تشيك فور ال 95، ما بنعملش ما فيش تدريب للموظفين على الهاند هايجين والبي بي اي، ما فيش ستورج صح، ما عندناش تدريب ان احنا نعمل تخزين صح للمعدات اللي احنا هنستخدمها مره تانية. المفروض المستشفى تعمل ايه؟ ما فيش تدريب مثلا للاوت بيشن ستاف، ما فيش عندنا resources كفاية. المفروض المستشفى تعمل ايه في الموضوع ده؟ او ايه الحلول اللي المفروض المستشفى تعملها لو عندنا كل المشاكل دي او كل الايرورز ده بيحصل when we are donning and doffing our PPE. What do you think? Hello? يا شعب أيها القوم، أخدتوا الأجازة ولا إيه؟ لو عندنا الأخطاء اللي إحنا قلنا عليها ال common mistake when we are donning and doffing، الستة اللي إحنا قلنا عليهم، المفروض المستشفى الحلول اللي المفروض تطرحها المستشفى أو تعملها المستشفى عشان يحسن من الأخطاء دي. Yes, resources، إن إحنا نوفر resources. Okay, thank you. سهلة اهي، سهلة نوفر resources and else. نعمل زي ما قلنا من شوية برضو walk around. Yes, yes, excellent معاد. Yes, excellent عبد الرزاق. Excellent نون. Excellent عبد الرزاق again. Yes, yes. تدريب، نوفر الريسورسز، نعمل اختبار لجودة المنتجات أو المعدات بتاعتنا، نعمل education شهري للإستاف بتاعنا. Yes, excellent. أو اختيار الجودة أو اختبار الجودة كمان للريسورسز، أو إن احنا نختار جودة كويسة للمنتجات بتاعتنا. رفع وعي الكادر. excellent. تمام. Okay, thank you. Excellent for all. I'm so proud of all, please. Really يعني. يلا نقول بقى ايه اللي المفروض المستشفى تعملها. The first one, an effective training and confirmed competency is the first and foremost. التدريب والكفاءة أول حاجة قبل أي شيء. Okay. Practicing this procedure in the hospital setting is helpful. إن إحنا نعمل ممارسة الإجراءات دي خاصة السيل تشيك فور ال 95 It's helpful to do this procedure in the hospital. An effective safety culture is critical, one that encourages open discussion when opportunity for improvement and observe whether big or small. Yes, excellent. تسلم يا عبد الرزاق. Excellent مع عمل الفرضيات كل 3 شهور تقريبا. It's so important والله in ESR and with FMS, with the infection control department, about this all. Really, it's so important. Not only for Sibahi, even for the staff, for the safety of us, for the safety of our work health caregiver or our healthcare provider. It's so important. Okay, an effective safety culture is critical. Healthcare workers are our front line, and it's a vital that they have the equipment and leadership support needed. Like who told عبد الرزاق, like you told, there is إن إحنا نوفر resources أو equipment. Healthcare workers are our front line, and vital they have the equipment and leadership support. It's so important for our front line to support them. It's needed to perform their job safely and prevent the risk of infection while treating and caring for COVID-19 patients. Here's all the link or YouTube's the CDC donning and doffing. All links. It's important for donning and doffing PPE from CDC and NHS. Here, removal and disposal of personal protective equipment. I think we're going to finish this slide also, but I want somebody to answer when the time to donning and doffing PPE. When the time to donning and doffing PPE, please. Donning when and doffing when. Here I can please, I have question. When is the time to donning and doffing PPE? I will show you the answer. I hope somebody will answer. When the time to donning and doffing PPE? When the time to donning PPE? عناية المريض. بصي، هو أنا السؤال إمتى هنلبس الPPE بتاعنا، وإمتى هنشيل الPPE بتاعنا، إمتى هنشيل الجاون والفيس شيلد والجلافز والحاجات دي، وإمتى هنلبسها؟ من أول من بداية العمل على طول ينون؟ نو. أو يمكن يومين من بداية العمل، أو من بداية البروسيس بتاعنا قصدك. Yes, excellent, excellent. Before, huh? Excellent, Noon and Abdulrazak. Before you enter patient care area. أيوة، لأ هنشيله وإحنا لسه جوه. إحنا لسه جوه عند المريض. هنشيل all our PPE. إحنا قلنا في غرفة، أيوة في غرفة معينة المفروض قبل ما ندخل للمريض بنلبس فيه. Yes, excellent, 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 excellent عبد الرزاق. إن إحنا نلبس فيه PPE بتاعنا. We will done before your inner patient care area. This our donning. Yes, excellent, excellent يا There is specific area for donning and doffing PPE, as we told before, and it's I prefer there is mirror or somebody will help us to wear our PPE also probably. Okay, doffing, it will be inside patient care area. We will remove all our PPE before going to out from the patient care area. Then we will leave only the mask. After we will be out from the patient care area, we can remove our mask, or we can leave it when we will still have patient in same area. Okay. Type here also. What type of PPE would you wear when we are transporting a sample, when there is a section oral secretion, when we transport a patient in a wheelchair, drawing blood from a vein, taking food or water sample, performing swab? Here, what type of PPE would we wear? Or responding to emergency where blood is spurting, irrigating a wound, taking vital signs. When we are taking vital sign, عايزين ناخد العلامات الحيوية، مثلا حرارة، ضغط، الحاجات دي، المفروض ابقى لابسة ايه؟ هقيس درجة حرارة مريض، المفروض ابقى لابسة ايه من PPE؟ gloves وماسك. excellent. او ممكن هو yes, better it's gloves and mask. Here it's written but it's wrong. Taking vital signs, none, general none. No, we should it's better to us to wear gloves and mask. Excellent Noon Mad. طيب when drawing blood from a vein، عايزين ناخد نسحب دم، نسحب عينة دم، المفروض نبقى لابسين ايه؟ Excellent, excellent Mad. Gloves, yes. طب yes, gloves. Thank you صلاح. Transporting a patient in a wheelchair، عايزة أنقل مريض مثلا من قسم لقسم معين، أبقى لابسة إيه؟ والمريض نفسه كمان يبقى لابس إيه المفروض، وخاصة لو مثلا من isolation لأقسام تانية for some process. Yes, excellent. Mask and Here also it's written general non-required, but it's important to wear mask and gloves. Yes, excellent. And it depends on the patient situation. Yes, excellent, Mad. Thank you, Noon. Thank you, Mad. Okay. Here, our conclusion. When caring for patient, healthcare workers appear to have differential risk for hand contamination based on their methods of donning and doffing PPE. Here will I just a second only. I want to show you small videos how to wear and don and doffing PPE probably from the CDC.
How to safely put on personal protective equipment or more commonly called PPE. We will demonstrate how to
الصوم بتاعنا here.
Safely put on personal protective equipment or more. How to safely.
Can you hear or it's not appear?
Put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory.
Please pay attention about the all steps here because it's so important really. When you lost any steps, you have to repeat all how to wear and how to remove or donning the PPE. It's so important. And we have how many mistakes about it. We have KPIs, the rates, it's high rate for the stuff. They don't know how to wear probably their PPE. Okay, please pay attention.
Protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer. sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown,
سامعين كويس
tie all ties, or snap all snaps. You may need assistance from another healthcare provider.
شايفين لازم يبقى في حد تاني برضو بيساعده طبعا الحاجات دي أغلبها مش بتتعمل عندنا يعني أو ما فيش مرايات هو هنا طبعا برضو المفروض يبقى
Put on the N95
يبقى
respirator.
مقفول كويس من ورا
When using a respirator with a
كويس.
nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece
هو ده
bulges
السيل تشيك
slightly.
اللي احنا قلنا عليه
Then, while keeping your
الإجراء
hands
بتاعه
over the
اللي تبع
respirator,
المفروض
take
صح
in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves.
هنا مهم
Pull the
جدا
gloves down so that
شايفين
they cover
الجلافز
the
هيبقى
wrist of
ازاي
the gown.
لازم يتحط على الجون بتاعنا بالطريقة دي لازم نبقى قافلين الجلافز مع
You are
الجون
now ready to enter the patient's room.
دلوقتي انت جاهز ان انت تشوف المريض بتاعك Okay, this video from CDC. We will make the other one for put, yeah, take off. No, not this one. Sorry. Doffing.
How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency.
Here also it's so important to be attention about how to doff the PPE because there is how many tricks أو في تريكات معينة كده ممكن تخلي الإجراءات اللي احنا عملناها تبقى غلط. فبليز pay attention also.
And removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out.
Here how to remove our gloves, glove to glove, or sorry, to be saved يعني dirty to dirty, clean to clean. Okay, like that we will remove the gloves. Okay.
With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the
Here, I want to ask you something. Why he remove from here, from down first, not from up? ليه هو فتح الجاون من الربر اللي تحت ده، ما قطعش أو ما فتحوش من فوق؟ Can you tell me about it? Why he removed the gown from here first, not from up? Even for mask, why we will remove from down rubber and then up? Did you know? ليه بنشيل الجاون من هنا الأول مش من فوق؟ أو حتى الماسك بتاعنا، ليه بنفك الماسك من الحبل أو من الربر بتاعنا تحت not up؟ علشان احنا لو فكينا الجاون من هنا، لو فكينا الجاون من هنا الأول قبل ما نفك تحت، هيقع مننا الجاون، وكده هنبقى احنا كمان كونتامينيتد. ممكن احنا يبقى هنلمس الجاون او الماسك نفسه ممكن يقع وهبقى كونتامينيتد. الماسك الحته الكونتامينيتد دي هتقع عندي مثلا على in our chain or in my chest, then I will be contaminated. For that we should remove from down rubber, not upstairs the first. Okay, please be attention about the steps how to doff also.
ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull.
And here how to remove the gown. Roll. How to roll our gowns.
Or roll the gown down and away from the body. Dispose of the used
ويبقى
gown.
بعيد عن الجسم عشان
You may now
الجاون من
exit
قدام
the
أصلا
patient's room.
contaminated.
Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without carefully over your head and by
هنا
grabbing
الطريقة اللي
only
قلنا
the
عليها
strap and
إن
bringing
هو
it carefully.
يشيل الربر اللي تحت من الماسك الأول. Okay, he will not remove the first one here, no, from down, because when he will remove from here, you will be contaminated.
Carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
And now we finish also this our slide about common mistake when donning and doffing PPE. This our reference. Thank you. Did you have any questions? Do you have any questions? Hello? Do you have any questions? About patient safety management and about how to don and doffen BBE and the tricks we have in BBE and in our hospital about the BBE. Thank you, thank you. Thank you, Jawahir and Ryan, thank you. I hope it's a useful lecture or you have interested lecture for with me, inshallah. Thank you, Khloud. Thank you, Majid. Thank you. Now we need to take break, please. And there is prayer time here also. I think not all Saudi Arabia, but we need to take a break, half an hour. Then we will continue until we will finish our lecture, inshallah. Did you agree? Okay. السلام عليكم. تقبل الله منا جميعا يا رب. We stopped before yesterday in our lecture of this patient safety principle and method applied to infection prevention control for suffer patient outcome. We talk about this all: leadership, teamwork, evidence-based practice, organizational learning, and measure care. We stop here before until the system thinking. We have system thinking, human behavior, human factor, theory, and high reliability. We talk about this all, and we stop here in this slide. As I told before, we will continue. Here, the system thinking. When we talk about the system thinking strategy for infection prevention control professional, we will see 3 steps or 3 points when designing or updating policy and procedure for staff to follow. Consider the entire system, like how the individual part interact and how one change will affect another, and how the system should work. Include all key stakeholders and test the system with a small pilot study before implementing the organization-wide. The second one ensures that the system provides for supplies, the staff can successfully perform the assigned task, and the last one, work with others to design a system to achieve and sustain success. Human behavior. Human behavior strategy for infection prevention professional. Consider it change effort as it related to organizational culture and human behavior model. Engage staff in changing effort to better understanding their value and motivation. Use behavior model when possible to implement change and improvement strategy that will reduce function risk. Here, the human factor, Troy. The human factor strategy in infection prevention control integrate human factor engineer principle, such as standardization and checklist, and also such as visual, such for staff expected behavior. And we should ensure the individual performing the work are competent, they are clear about the task being performed, that the tool and technologies involved work properly, and think about factory change as a systematic rather than an individual change. Here about the human factor, Troy. Also selected human factor principle with application to design infection prevention control practice, simplify the process, and standardize the process, reduce depends on memory, use forcing function, work toward reliability. Then, no blame culture. No blame, just cultural strategy for infection prevention control professional. Help maintain a just no blame culture by continually focusing on evidence-based practice, epidemiology, and system rather than blaming individuals. We talk about it. Use critical thinking to identify and analyze the causes of error, like root cause analysis or 5 whys, to infection so they can be prevented in the future. Engage other caregiver in the analysis of error to share ideas and perspective. Here, zero tolerance philosophy. It's so important also to use this philosophy for who not implement any process or any policy or any procedure in the organization. Maintain a zero tolerance approach to patient safety is circular for suffer care to minimize infection or error. Leader must not tolerate non-adherence to proven prevention measure. If staff discard safety rule or best practice, when our staff discard or ignore the safety rule or best practice, such as failing to perform hand hygiene at appropriate time, handling infectious waste inadequate, or skipping critical step in cleaning, disinfection, or sterilization. This philosophy we should use in these ways. Here, the high reliability include 3 critical requirements for success: the leadership, a safety culture, and robust performance improvement. The example like principle, preoccupation with failure, the infection prevention example, impressing and learning from failure such as healthcare associated infection. The principle also reluctance to simplify, understanding failure by effective analysis and looking at system rather than blaming individual when infections occurs. Okay, commitment to resilience, knowing that error and infection can be decreased with persistence towards improvement in practice. Effective and open communication. Communication strategy for infection prevention control. Make routine round and discuss patient with infection or those at risk. Share surveillance data. Develop a secure system. Encourage open discussion about infection risk with leader and ask them to convey the information to the organization. And the last one, use a checklist and other document to help communicate. What does the future hold for patient safety and infection prevention control? The basic practice of infection prevention control include hand hygiene, aseptic technique, cleaning, disinfection, and sterilization remain critical to suffer patient care. That is the future hold for patient safety and infection prevention. Basic practice for infection prevention control. New technology will emerge to help prevent infection. Constant use of basic infection prevention principle and incorporation of new evidence-based care. Here we finish this one. Now we will talk about technology and its effect on patient safety. Thank you, Noon. Did you know or you have any information about the technology can affect in patient safety? هل التكنولوجيا هتأثر على البيشنت سيفتي؟ التكنولوجيا ليها تأثير كبير وفعال على البيشنت سيفتي ولا لا؟ Just a second please. Yes, it's so important the technology to implement our patient safety. Like what? احنا عندنا تكنولوجيا بتأثر جدا في البيشنت سيفتي زي ايه؟ ممكن زي ايه؟ الباركود، الاي دي اللي بنلبسه في الريست لما نيجي نعرف المريض بالباركود ده. مش دي تكنولوجيا وهتأثر في المريض والناس. Just a second please. مقياس الكلورين في محاليل التعقيم يعني ايه يا نون؟ الكلورين في محاليل التعقيم. هو في تكنولوجيا معينة في قسم التعقيم. يس طبعا أنا ما فتيش ما أعرفش عنه. It's excellent also when there is any technology in the CSSD. Good. Technology has been expanded in healthcare at the exponential speed. Many of the new technology were thought to be answer to patient safety and quality issue, like the barcode, like when we are entering the identification for patient. يعني لما نحط معلومات للمريض، معلومات المرضى أو السجلات دي كلها عبارة عن تكنولوجيا بتأثر على البيشنت سيفتي وجودة المستشفى. While new technology has reminded many issues, it has also created new issues that must now be addressed. As I told, like when we are registering patient information, when we are registering any prescription inside our technology in the pharmacy. when we are making the request for any process like laboratory or radiology or even the pharmacy, from department to department, it's effective also in patient safety. Okay. Several of this technology advance will be discussed here with the positive and negative that have result from their use. We have advantage and disadvantage of the technology we are using in the healthcare organization. The technology a step toward achieving patient safety, because if the importance of the patient safety and protecting them from healthcare error, we should have technology. Even our all standards, it's better to put in the system, like archives also, like all information of patients. Several institutions and organizations concerned with patient safety moved and conduct study and report. And one of the most permanent of this report was the report issued by IOM Institute of Medicine in United States of America in 1999 regarding activities that campaign organization by the World Health Organization in also 2005 under the slogan and of the word allied for patient safety is the most prominent activity in the world. There are measures taken to improve patient safety, such as health facility accreditation program, as a part of a standard of accreditation institution required the existence of document, policy, and procedures that work to provide safe health care. We have top patient safety issue and hazard. Beginning in 2014, Emergency Care Research Patient Safety Organization issued the first top 10 patient safety concern of healthcare organization. For multiple healthcare settings, also released the top 10 health technology hazard every fall. The top 10 lists are designed as a starting point for healthcare organizations to identify any of the risks and to begin the prioritization the issue at their organization. Organization contribute data to the patient safety organization in protect manner as a result of patient safety and quality improvement. All this information is then compiled and analyzed to create this list. At the first, we will talk about the top 10 health technology hazard. Top 10 patient safety concern into 2015. At the first, alarm hazard, inadequate alarm configuration, policy and procedure, data integrity, managing potential violence, mixed up of IV line, core coordinate event, failure to conduct independent double check, opioid related event, inadequate patient handoff, medication error related to pound and kilogram. This, the first one, top 10 for patient safety concern. Here, top 10 health technology hazard, also alarm hazard, data integrity, mix up of IV line, inadequate reprocessing of endoscopies and surgical instrument, ventilator disconnection, patient handling device, dose creep, robotic surgery, or overwhelmed recall and safety alert management program. Here, the first one we told about computerized physician provider. This help the physician to enter information for the patients, or entering the request for the patient when he want to any process or any treatment. It's better because it's appear, or it's be clear more than to written on paper. When the physician enter the information directly in the computer, better than when he will write his prescription or his request on paper. Okay, computerized physician provide are prescribed or NQF order enter a computerized physician order entry, CPOE system allowed the clinician to enter directly an order into the computer rather than writing on paper. The order enter so the computer electronically transmit directly to pharmacy or other department, then link the patient other information into electronic health record. الأفضل إن هو يحط المريض الطبيب يحط البيانات ويدخل البيانات بتاعته مباشرة للكمبيوتر، أفضل من إن هو يكتبها على الورق. هتبقى واضحة أكتر، كلير أكتر، هيوصل في وقت أسرع. طبعا الحاجات دي كلها ليها عيوب وليها مميزات، بس مميزاتها طبعا إن هي كلير، مش هتبقى زي الكتاب. يعني بريسكريبشن لما الدكتور يكتب بريسكريبشن هو ما فيش حد غير الفارماسي اللي بيفهم في البريسكريبشن ده. Anybody cannot read the prescription for doctors. For that, it's better he will enter all information in the computer. المعلومات بتاعته كلها يتحط على الكمبيوتر أحسن، لأن ممكن بعض الخطوط ما بتتقريش، فده هيأثر على البيشنت سيفتي، هيأثر على الوقت كمان، هيوصل الحاجات دي بتوصل بسرعة. وين the net is it's okay يعني. ممكن من السلبيات إن إحنا مثلا ممكن ما يكونش فيه السيستم واقع زي ما أحيانا بيحصل في بعض المنظمات يعني. دي من عيوب التكنولوجيا، لكن مميزاتها أكتر من عيوبها وبتأثر على البيشنت سيفتي. وإن هو يقدر يرسل الطلب مباشرة للصيدلية أو للسجل الطبي أو للأقسام التانية زي المختبر والأشعة. طبعا كل الريسيرش والتوصيات أكدت على استخدام CPOE خاصة في الجودة أو National Quality Form رجحوا إن هم يستخدموا ال CPOE Computerized Physician Order Entry عشان يقللوا من أخطاء البشرية. دي أول معايير استخدموها في ال LeapFrog Non-Profit Organization for Patient Safety. The most system interface with clinical decision support system, which includes suggestion or default value for drug dose, route, and frequencies, and may also check for drug allergy, drug-drug interaction, drug laboratory value, drug guideline, or promote for corollary lab test. The CPOE computerized physician order entry was recommended to be implemented in the two-year is human report was one of the LeapFrog first standard. Here the CPOE also is effective in reducing error for this prescription or for medication occurring at the dispensing and administrative stage of the medication process. Its effectiveness also in reducing clinical adverse events. While this computerized has been shown to be quite effective in reducing error related to prescribing the medication, it has not been effective in error occurring at the dispensing and administration stage of the medication process. Its effectiveness in reducing clinical adverse event is less clear. Several studies have shown that CPOE doesn't reliably prevent patient harm with persistence of high rate of adverse drug event. Other studies have been also seen in computerized implementation be effective in preventing this type of event. There is postulation that the clinical decision support software may account for the difference. Barcode medication administration. This also system we are using for medication also. For the safety of managing the medication. Okay, yeah, sorry. The use of wireless mobile handheld barcode medication administration safety system. Barcode medication administration is now community standard in hospital. But how we are using this barcode in the pharmacy? Sometimes when the patient has files in the hospital, he can, by this barcode, he can read his prescription. It's so effective. And when by this barcode also, the patient safety department, sometimes they can read the when there is anything in the prescription of the patient, and they can be sure about the 5 rights of medication. Barcode scanning is old machine readable identification system. It's used system to reduce medication error rate and improve patient safety. The barcode system has been utilized to assure that the medication is administered correctly with the 5 rights or the 10 rights, like we mentioned yesterday also, of medication administration. It has reduced medication error as much as 65% from to 86%, and adverse drug events have also decreased. The barcode here, like here, this they are holding here in the phone. The barcode is applied to each unit dose, item-specific identification, and scanned by nurses at the bedside to connect the right medication with the right patient. It's so effective system or technology in medications. The barcode system is useful on patient unit medication administration and laboratory specimen collection in preoperative and post-operative area like radiology and emergency department also. The benefit for any inpatient setting include the accuracy in confirming the 5 rights, seamless integration with electronic record, comprehensive data for performance measurement and improvement. The study have shown that medication administration error can be reduced if the barcode system is utilized correctly. كل الدراسات أثبتت إن لو النظام الباركود ده بيتطبق صح هيبقى يحصل أخطاء، يعني هيقل الأخطاء الدوائية في المستشفيات. However, when first implemented, nurses and others found way to work around the proper use of the barcode system. The workaround have led to an anticipated consequence when administration medication on workaround was related to how the system is done. Some nurses identify they had been trained to give the medication before documentation, so it's circumvent the system. Retraining was needed. في حاجات بتحتاج إلى إعادة التدريب ليها. Another issue was the barcode on the patient armband was too lightly printed on the armband reflect light, so the barcode could not be read. ممكن الطباعة مثلا في الباركود اللي قلنا عليه in the arm of the patient ممكن يكون خفيف فما نقدرش فيعكس الإشارة دي بتعكس الضوء ما نقدرش نقرأ. This also the disadvantage or negatives. A study examined how the use of the electronic medical record and barcode medication administration affect the accuracy of medication administration rate within two hospitals. They found that after the implement of barcode system, the السلام عليكم. أنا آسفة جدا جدا، النت كان فصل. آسفة على العطل الفني ده. عمالة أشرح وأتاري النت فاصل يعني. I'm so sorry. نكمل المحاضرة بتاعتنا. Radio frequency identification. This is a type of automatic identification system using digital memory on tag that to track medical devices or drug. سامعني؟ مش شايفة أي فيدباك يعني. سامعني وأنا وصلت ولا لسه ما وصلتش عندكم؟ طيب الحمد لله. What is that? Okay. The tag may contain information about the lot number of expiration data of medical supply and drug of allergy and blood type for patient, or the physician or physical location of equipment, like sometimes they make the system with what we call narcotic medication. Okay. الو، انا مش عارفة في ايه بجد. The barcode is read only. Okay. Okay, good. Thank you. قاسم ابتسام وأمواج. يا دوب شايفة الفيدباك بتاعكم. Each chip has unique electronic product code. Data can be read by sensor from a distance and through material like clothing, wristband, boxes, and band, and can be transmitted to a host computer for processing and tracking. Like I think this the barcode we are using also when there is a COVID-19 في لما كانوا بيعملوا لما كان في أزمة COVID-19, when we are going the malls or any organization, they have barcode or Q code. كان في باركود للتراكنج يعرفوا مثلا كام شخص، لأنه كان بيكون محدد إن الأشخاص تبقى موجودة مثلا في مول في organization معينة، يبقى عدد معين، فبالباركود ده كانوا بيعرفوا في توكلنا. أكيد شفنا الحاجة دي كمثال يعني. بتوكلنا الباركود أو الكيو كود دي كان بيعمل tracking for the persons، يعني يعرفوا كام شخص في المول ده، هل تعدى الرقم اللي المفروض هم محددينه ولا ما تعداش. Okay. This for tracking person or even the drug, like I told this narcotic, because it's dangerous medication. In healthcare, radio frequency identification utilized for 3 purposes: assist management, patient care, and inventory management. The radio frequently assist management to help organization know where equipment is located throughout the building. The tag are utilized on IV pump also, surgical card, and other such equipment to decrease a time lag in trying to locate the equipment. It also helps to find the equipment when it's due for preventive maintenance, thus meeting the standard for equipment management and assuring the patient safety of equipment. The inventory controlled radio frequency identification is utilized to track supplies from receiving through the location where it's to be used. مهمة للحاجات دي كلها. When it comes to the patient care uses, there are multiple uses from tracking patient who wander or leave the unit for testing, surgery, treatment, and so forth. The patient identification to surgical sponge and instrument, the tracking when clothing a surgical incision, and so forth. Also, tag can also be utilized in abduction and elopement system to let you know when an infant has left the unit. For this all, it's important. اسمه ترددات الراديو. دي أنظمة بتحدد الهوية الأوتوماتيكية في ذاكرة رقمية كده في العلامات بتتبع بتعمل تتبع للأجهزة، تتبع للموظفين، تتبع للمرضى. بتستخدم برضو بتكون علامة على معلومات المستلزمات الطبية أو الأدوية أو الحساسية أو فصيلة الدم، وبيحدد برضو الموقع الفعلي للمعدات والأجهزة بتاعتنا أو الأدوية، أو مثلا جهاز معين خرج من المستشفى أو مثلا من شركة معينة في مستشفى أو المستشفى اشترت جهاز معين، بيبقى فيه تتبع بالباركود ده أو الراديو فريكوانسي، تتبع للجهاز ده خرج من فين لحد ما يوصل للشخص أو للمستشفى أو المنظمة اللي اشترت الجهاز، في نظام تتبع. عشان كده بقول حتى الناركوتكس عشان دواء مهم وخطير ليه تتبع، بيشوفوا خرج منين. يعني كل المناطق أو كل الأماكن اللي تواجد فيها مثلا الدراجز دي بتكون متسجلة عندهم عن طريق الترددات الراديوية دي. Here, the radio frequency, the disadvantage is expense of equipment, both hardware and software. Also, in the past, there were questions as to whether the radio frequency identification interfere with equipment such as anesthesia equipment, but that seems to have been resolved now. Abduction or element security system ده أنظمة أمان اللي بتتعمل لو في خطف مثلا أو في حد هرب. According to the most recent available data, there were 0 infant abduction from healthcare facility between 2013 and May 2015. بعد ما تركبت أنظمة الاختطاف دي في بيانات كانت بيانات متاحة إن في حالات الاختطاف بقت وصلت ل0 في المستشفيات من عام 2013 لحد 2015. لكن قبل كده من سنة 83 ل 2012 كانت حالات الاختطاف في الأطفال حوالي 132. However, from 1983 until 2012, there were 132 abductions from healthcare facility. For those, the hospital and other healthcare facility must remain vigilant. Here, the abduction equipment security system. It's also active radio frequency identification technology is used increasingly for infant and pediatric security to prevent abduction. بتستخدم لأمن الرضع والأطفال عشان يمنعهم من نحد أو نقلل من الاختطاف ليهم. Abduction prevention system usually have a soft self-adjust bracelet that is placed around the infant or child wrist or ankle. بيكون عبارة عن أسورة بيستخدمها بنركبها للطفل في إيده أو في رجله، في الكاحل أو في المعصم. أول ما أي حد بيعمل على إزالة الأسوارة دي على طول بيدي إنذار للتمريض، وبرامج الكمبيوتر بتعمل تنبيه لقسم التمريض مثلا أو السكيورتي مثلا، فبيعمل السيستم ده على طول يقفل الأبواب والأسانسيرات. لو حد عايز يطلع الأسوارة دي على طول بيعمل على طول، هو مربوط بأن هو الأبواب بتاعة المستشفى والمصاعد كلها بتتقفل وبيتحول لنظام اسمه نظام الإغلاق lock down mode. If the bracelet is removed or cut off, an alarm signs the nurse situation and computer software alerting the healthcare staff. Usually the facility incorporates door and elevator lock and goes into lockdown mode. If bracelet is removed or someone attempt to take the infant to the door or down the elevator with the bracelet is still on the child, some system utilize a mother-infant match system also, where the mother is given a tag or band with the same code as her infant to serve and additional and automatic identification. عشان يبقى زي تعريف إضافي بيعملوا برضو نفس البريسلت أو نفس التعريف ده للأم وابنها عشان يبقى زي تعريف إضافي يعني. Most healthcare facilities only utilize this system on newborn infant when in fact children of all age can be abducted from a facility. هما السيستم ده بيستخدموه بس للرضع، فدي برضو من الديسادفانتج. هو المفروض ان هو يستخدم لجميع الاعمار في للاطفال، لان ممكن اي حد يتعرض للخطف، حتى الكبار ممكن يتعرضوا للخطف، فالمفروض ان هما السيستم ده يستخدم even for not for infant or newborn patient, but for children also in all age. More than 3,050 family abduction occur in USA each year, with 47% of these cases involving the concealment of a child. حوالي 350,000 حالة اختطاف بتحصل في الولايات المتحدة الأمريكية، بما يوازي يعني 47% من الحالات فيها إخفاء الطفل أو إن هو اتنقل خارج الولاية. This same type abduction prevention system can be utilized on pediatric unit، ممكن في قسم الأطفال أو العيادات أو غرف الطوارئ أو أي منطقة بنسيب فيها الأطفال لوحدهم. حتى أعتقد أحيانا بيكون في بعض الملاهي الكبيرة بيعملوا لهم الإسوارة دي، يعني لأن ممكن الأطفال تتوه أو تتخطف أو تضيع. Okay. It has been estimated that between 25% and 70% of adults with dementia but still living at home will wander at least once. Of nursing home residents, 31% will be found wandering. In a 2006 study, it was estimated that 1 in 5 people with dementia will wander also. For this also, the red frequency identification is also useful for prevent elopement by wandering patient. المرضى المتجولين أو اللي بيكونوا اللي عندهم زهايمر مثلا أو فاقدين الذاكرة والحاجات دي، فممكن السيستم ده ينفعهم هم كمان من الهروب أو من إن هم يتخطفوا أو من إن هم يتوهوا يعني. This generally helpful in setting where patient residents are ambulatory, have short-term or long-term cognitive impairment, and may stray away from a location, wandering or try to leave the unit without permission, needed supervision. As I described above, with infant and pediatric security system, the radio frequency identification device can be linked to door locking mechanism. The patient resident wear a tag and strap designed to prevent removal. It works with system that monitor and control specific exit door. If a patient or resident approach and exit the door, controller lock the door if the door is open. An alarm sound. Certain alert system include option for central reporting integration with other security system and real-time patient resident locating. Here, my last slide for this lecture. Recommended to improve patient safety outcome when using health information technology, which include the following: the health information governance, safety risk identification, stakeholder involvement, informed decision, sufficient training, gradual implementation, continuous evaluation and monitoring of patient safety outcome, technology optimization, regular technology update. That is our reference. Thank you. This how many examples only for the technology is effective in patient safety. Okay. Here, computerized physician provide the barcode medication for medication. And here, radio frequency identification. Do you have any question? Do you have any question, please? Okay, I will continue the other lecture. سننتقل إلى المحاضرة الثانية. عندكم أي أسئلة؟ تأثير التكنولوجيا في البيشنت سيفتي. Hello, everybody. Now we will talk about infection control and sterilization in dentistry. نتكلم عن infection control في الأسنان. The mechanism of transmission, mechanism of escape, natural and artificial. Natural oral activity such as sneezing or coughing, artificial hand instrument. The method of entry, inhalation, ingestion, contact with mucous membranes, or penetration of intact skin. آليات انتقال العدوى بتكون طبيعي أو مصطنع. طبيعي زي العطس والسعال، أو عن طريق مثلا الصناعي مثلا artificial hands، والinstrument عن طريق الأدوات والإيدين. Here also the method rationale of infection control. Microorganisms can spread from one person to another via direct contact or indirect contact, droplet infection, and airborne infection. The direct contact by touching the soft tissue or teeth for patient, it causes the immediate spread of infection by the source. The indirect contact result from injury with contaminated sharp instrument, needle stick injury, or contact with contaminated equipment and surface. The droplet infection by large particle droplet specter, which is transmitted by closing contact or procedure may deliver microorganisms to the dentist. The cross infection is a transmission of infection agent among patient and staff within clinical environment. The different route of spread of infection, patient to dental health care person, or dental health care person to patient, or patient to patient, or dental office to community, or community to patient. Here, the chain of infection. I think Dr. Noura, she talked about it all. Reservoir, portal of exit, mode of transmission, portal of entry, and how to break this chain. We need to break this chain to prevent the infection. The object of infection control reduces the available number of microorganisms, inhibit the spread, or break the cycle of cross contaminate. الأهداف بتاعتنا في برنامج مكافحة العدوى إن احنا نقلل العدد المتاح أو to make prevent للجراثيم، أو إن احنا نحد من انتشارها ونكسر الحلقة بتاعت التلوث اللي احنا قلنا عليها the chain infection chain. Here this is the objective of infection control. Treat all client and clinician as if infected. لازم نتعامل، احنا كلنا نتعامل مع بعض على ان احنا كلنا بننقل العدوى، عشان كده لازم ناخد احتياطاتنا وناخد حذرنا عشان to wear our correct PPE. Protect from exposure, infection and disease، عشان الحماية من التعرض والعدوى والأمراض. This all the objective of infection control. The same procedure are used for all patients. The standard precaution, the same procedure assume all patients are potentially infectious. Not only the patient, but all, even the healthcare worker or clinician. Okay. Infection control policy are determined by the procedure, not the patient. Sterile and non-sterile gloves. Universal precaution, there are as follow: immunization, use of personal protective barrier technique، نستخدم تقنيات معينة لحماية الشخصية، الحفاظ على نظافة الإيدين، اتباع استراتيجيات عشان نقلل مخاطر العدوى اللي بتسببها الأمراض اللي بتتنقل عن طريق الدم زي الفيروس، نقص المناعة، أو the pathogen such as hepatitis V or HIV. The immunization, all members of the dental team who are exposed to blood or blood contaminated article should be vaccinated against hepatitis B. لازم إن إحنا نحصن اللي بيشتغلوا في الأسنان عشان هم بيتعرضوا للدم والمواد الملوثة بالدم، إن إحنا يتعمل لهم تحصين أو تطعيم ضد التهاب الكبد hepatitis B. Here the personal protection equipment, barrier technique, the use of barrier technique is very important. يبقى عندنا الحاجز، تقنية الحاجز مهم جدا. Which include gown, face mask, protective eyewear, and glove mask should be changed regularly and between patients. The outer surface of the mask can get contaminated with infection droplet from spray or from touching the mask with contaminated finger, so should not be reused. If the mask become wet, it should be changed between patient or even during patient treatment. لو الماسك حصل مثلا انه اتبل او حصل فيه اي خلل، لازم نغيره، حتى لو احنا ولسه بنعمل الاجراء مع نفس المريض يعني. The maximum time for wearing a mask should not be more than 1 hour, since it becomes dampened from respiration, causing its degradation. In order to greater protection against splatter, a chain-linked plastic face shield must be worn in addition to face mask. To remove the mask, grasp it only by its strength, not by the mask itself. الفيس شيلد أو الفيس فيس شيلد مهم برضو إن إحنا نستخدمه، وخاصة يعني زي ما قلنا قبل كده ال person when لو في مثلا طبيب أو technician they have chain عندهم دقن، يبقى فيه الدروع البلاستيك دي اللي face shield. والماسك برضو يتم إزالتها عن طريق الربر اللي ورا. Here in the dental clinic. The glove, don't wash glove before use or for reuse. Remove gloves that are cut, torn, or punctured. Hand hygiene for most routine dental procedure. Washing hands with plain non-antimicrobial soap is sufficient. For more invasive procedure such as cutting of gum or tissue, hand antiseptic with either an antiseptic solution or alcohol-based hand rub is recommended. Here, don't wash your gloves, and when there is cut, you should remove and change. The definition of cleaning, it's a process physically remove, contaminate, but doesn't necessarily destroy microorganisms. We talked about it yesterday. Disinfectant is a process using agents that destroy germs. It's a chemical substance caused disinfection. The antisepsis, it's the destruction of pathogen microorganisms exist in their vegetative state on living tissue. Antiseptic, it's a chemical applied to living tissue such as skin, mucous membranes to reduce the number of microorganisms present. The sterilization involves any process, physical or chemical, that will destroy all forms of life, include bacterial and fungi, spore, and virus. احنا اتكلمنا عن الكلين والديسنفكشن. التعقيم بتكون برضو أي عملية فيزيائية أو كيميائية بتعمل على إن هي بتعقم لنا الأدوات أو الانسترومنت بتاعنا، وبتنظفه من البكتيريا والفطريات والجراثيم والفيروسات. Calcification based on dental instrument or on risk of transmission and need of sterilization, critical, semi-critical, or non-critical. Critical instrument penetrate mucous membranes or contact bone, bloodstream, or other normally sterilized tissue. Heat sterilized between uses or use sterile single use. Disposable device example include surgical instrument, scalpel blade, or and surgical dental pairs. There are 3 categories of patient care item depend on their intended use and the potential risk of disease transmission. الكريتيكال انسترومنت دي الادوات اللي زي بتخترق الاغشيه المخاطيه او بتتحط مثلا في مجرى الدم او الانسجه المعقمه. فالتعقيم الحراري بين استخدامات او استخدام الاجهزه المعقمه زي الاستخدام الجهاز الحاجات اللي بتستخدم مرة واحدة أو اللي يمكن التخلص منها زي الأدوات الجراحية. They have high risk of transmitting infection and should be heat sterilized between patient uses. Use sterile and single-use disposal device. Example include surgical instrument, periodontal scaler or scalpel blade, or surgical dental burrs. ده زي الحاجات اللي برضو بتستخدم مرة واحدة زي الأدوات الجراحية اللي بيقيسوا بيها دواعم السن مثلا أو المشارط. Okay. The semi-critical it's contact mucous membranes but don't penetrate soft tissue، يعني مش بتخترق الأغشية المخاطية زي مراية بتاعت الفم بتاعت الأسنان. Like yes, a dental mouse mirror and dental hand. This semi-critical item contact only mucous membranes and don't penetrate soft tissue. As such, as they have a lower risk of transmission because most items of this category are heat tolerant. They should be heat sterilized between patient uses. For heat-sensitive instrument, high-level disinfection is appropriate. Example, semi-critical instruments include dental mouse mirror and impression tray. Dental hand pieces are a special case, even though they don't penetrate soft tissue. It's difficult for chemical grimicide to reach the internal part of hand pieces. For this reason, they should be heat sterilized using a steam autoclave or chemical vapor sterilizer. This the semi-critical instrument. The last one, non-critical instrument and device. Contact intact skin, clean and disinfectant using a low to intermediate level disinfection. Example, X-ray head, face bow, pulse, blood pulse oximeter, blood pressure cuff. This all non-critical instrument and device. Only contact intact unbroken skin, which serve as effective barrier to microorganisms. This item carries such a low risk of transmission. It must have label claim for killing the HIV and HBV, hepatitis V. However, if an item visible blood, it should be clean and disinfected using intermediate level disinfectant before use on other patient. ده برضو الأدوات الجراحية يعني أو الأدوات أو الأجهزة الغير حرجة زي أجهزة الأشعة أو قياس ضغط الدم. الحاجات دي ممكن التعقيم بتاعها أو التعقيم بتاعها بتكون تعقيم مستوى منخفض مش critical. It's non-critical. وفي برضو ليها ملصقات معينة عشان نوع التعقيم بتاعها أو التطهير ليها. Example of instrument like we mentioned before above. Here, the accepted method of sterilization in our dental practice are moisturization or steam heat sterilization، التعقيم بالحرارة الرطبة أو البخار. dry heat sterilization، تعقيم حراري جاف. chemical vapor pressure sterilization، تعقيم بخار كيميائي بالضغط البخار الكيميائي. ethylene oxide sterilization، تعقيم أكسيد الإيثيلين. This is acceptable in the dental practice. The steam heat sterilization, autoclave sterilization with steam under pressure time 1020 is 15 minutes at 15 psi of pressure. Advantage: time efficient, good penetration. The results are constantly good and reliable. The instrument can be warped prior to sterilization. The disadvantage of this process: blunting and corrosion of sharp instrument. المزايا بتاعتها انها يكون في كفاءة في الوقت واختراق جيد للجراثيم والادوات نفسها كلها، والنتائج بتبقى جيدة وموثوقة. المساوئ بتاعتها انها ممكن تعمل تآكل للآلات الحادة او تعمل تلف للادوات المطاطية اللي يعني ما ينفعش انها تتحط فيها يعني. this disadvantage. هنا طبعا درجة الحرارة برضو 1210 درجة مئوية في 15 دقيقة عند 15 ضغط. the pressure. Dry heat sterilization. Conventional dry heat ovens achieved at a temperature above 1600 for 2 hour advantage. The advantage of dry heat corrosion is seen in the carbon steel instrument and burrs maintain the sharpness of cut instrument, low cost of equipment. The disadvantage of this process: long cycle is required because the poor heat conduct and poor penetrating capacity. High temperature may damage heat sensitive items such as rubber or plastic. Good, generally not stable for hand pieces. ده التعقيم الحرارة الجاف. درجة الحرارة بتاعتها بتبقى أعلى من 1600 لمدة ساعتين. ده ممكن المزايا بتاعتها بنشوفها في الأدوات المصنوعة من الفولاذ الكربوني. العيوب بتاعتها بتعمل ضعف توصيل حراري، ضعف قدرة الاختراق، بتؤدي درجة الحرارة المرتفعة إلى أنها بتتلف العناصر الحساسة للحرارة زي المطاط والبلاستيك. The chemical vapor pressure sterilization. Chemical operate at 1320 the temperature and 20 lps of pressure for 30 minutes. The active ingredient is 0.23% formaldehyde. Advantage: the carbon steel and other carbon sensitive burrs instrument and player are sterilized without rust or corrosion. The disadvantage item sensitive to elevated temperature will be damaged. Also, instrument must be very lightly packed. The towel and heavy clothing cannot be sterilized. Here, the disinfection of a dental unit and environment surface. Dental unit cleaned by disposable toweling. التنظيف بيكون عن طريق مناشف نقدر نتخلص منها. دي الإيبا وكالة الحماية البيئة. استخدام تنظيف أو مطهر المستشفيات لازم تكون مسجلة من وكالة الحماية البيئة، مثل زي الفينوليك. هي مركبات برضو بتحتوي على الكلورين. أعتقد بانون اللي قالت عليها. chlorine contain compounds. Environmental surface. Clinical contact surface high potential for direct contamination from spray or spatter or by contact with a glove hand. Housekeeping surface does not come into contact with patient or device with limit risk of disease transmission. There are two categories of environment surface: clinical contact surface. The clinical contact surface have a high potential for direct contamination from patient material, either by direct spray or sputter generated during dental procedure, or by contact with the dental health care provider glove hand. This surface can later contaminate other instrument, device, hands, or gloves. Housekeeping surface do not come into contact with patient. هنا الانسترومنت ممكن يبقى فيه الأسطح دي كلها فيها جراثيم متلوثة، لأنها الحاجات دي كلها تعرضت مباشرة مع المريض عن طريق مثلا الرذاذ أو كحة أو العطس اللي بتحصل أثناء إجراءات الطبيب نفسه. Then here our clinical contact surface. This we mentioned before. Here the table also. Even this for door. This all clinical contact surface. Cleaning clinical contact surface, risk of transmission infection greater than for housekeeping surface. This we mentioned before, clinical contact surface. The cleaning, then clean, then in disinfectant using an EBA register law to intermediate because clinical contact surface come into direct contact with contaminated gloves, instrument, or spray, or sputter, the risk of transmitting infection is greater than the house. What happened? The housekeeping surface. This surface can subsequently contaminate other instrument, device, hand, or gloves. Here, the housekeeping surface. The example, it's they are showing by arrow. Routinely clean with soap and water or EBA registered hospital disinfectant. Routinely clean or mops and cloth with mops and cloth, and allow them to dry thoroughly before reusing. Prepare fresh cleaning and disinfectant solution daily and per manufacturing recommendation. Thank you. You have any questions here? You have any questions? There is any questions, please? Until now, we have my last lecture, inshallah, today. We have one lecture only, the last one. You have any question here? That is my last lecture, inshallah. We will talk about management of healthcare worker exposed to COVID-19. The active monitoring, establishing regular communication with potentially exposed people to access for the presence of fever or respiratory symptoms like cough, shortness of breath, or sore throat. Just a second, please. Exposure is defined as anyone with any of the following exposure, like being within 2 meters of confirmed COVID-19 cases for more than 15 minutes without wearing an appropriate mask, provide direct care for confirmed COVID-19 patient without using proper personal protective equipment. The PPE include direct contact with infectious secretion or exudation of the patient, like being coughed on, touching used tissue with the upper hand, living in the household with a confirmed COVID-19 cases, sharing a room or meals or other space with confirmed COVID-19 case, sitting within 2 rows in any direction of confirmed COVID-19 cases for more than 15 minutes, and any crow in direct contact with the case in a public or shared transportation. This is the exposure of the healthcare worker. The healthcare worker defined as all staff in healthcare facility involve the provision of care for a COVID-19 infected patient, includes those who have been present in the same area as the patient, as well as who may not have provide direct care to the patient, but who have had contact with the patient body fluid. Also, potentially contaminate item or environmental surface. This include healthcare professional, like cleaning and laundry personnel. Contact tracking. Here, there is contact tracking for healthcare worker. Facility should identify and track all healthcare workers who had risk of exposure with confirmed, like before they are using like tawakkalna, COVID-19 patient according to risk classification low and high. Determine of the time period that confirmed COVID-19 patient or healthcare worker could be infectious for proper contact tracking. The first one, for informed COVID-19 healthcare worker patient who developed symptoms, consider the exposure window to be 2 days before symptom onset. The second one, for confirmed COVID-19 healthcare worker or patient who never developed symptoms, they should be considered potentially infectious beginning 2 days after their exposure. If the date of exposure cannot be determined, use a starting point of 2 days prior to the positive test result. Epidemiological risk classification for healthcare worker following exposure to patient with coronavirus disease or their excretion in a healthcare setting and their associated monitoring and work restriction or recommendation. Here, the epidemiological risk factor. When healthcare worker PPE protect with complete PPE and wearing only face mask or respirator, the exposure will be low. The recommended monitoring for COVID until 14 days after last potential exposure, it will be self-monitoring. If symptom of healthcare worker must apply universal masking and continue his or her duty, he will continue his or her duty. If symptom appear, must refrain immediately from clinical duty and report to infection control. He will make the form and they will report to infection control also. If the healthcare worker PPE not wearing, he didn't wear a face mask or respirator, and not wearing all recommended PPE, it will be exposure category, it's high. The recommended monitoring, it's active monitor. The all healthcare workers of high risk exposure continue their work also with a strict adherence to universal mask during their presence in the healthcare facility. This this table from the MOH. In their lounge during break time as long as they are asymptomatic, if symptomatic within 5-day test, and isolate accordingly. The healthcare worker informed their facility occupational health program if they had high-risk community exposure, like roommate in nurses or housekeeper housing. Healthcare worker who have a community exposure should undergo monitoring without nasopharyngeal swabbing and continue their work with universal mask as long as they are asymptomatic. Asymptomatic exposed healthcare worker in any of the risk exposure category, low or high, should be restricted from work. Here, when the healthcare worker return to their work, return to work of healthcare worker infected with COVID-19, the symptomatic healthcare worker, no shortage of staff, 7 days have passed since the start of the symptom. The healthcare worker who care for long-term care, the patient are performed to be tested by RDT. The specific test for COVID-19 also. I think it's in the pharmacy. Confirmation with PCR. The moderate staff shortage. 5 days have passed since the start of symptom. The healthcare worker who care long term also prefer to be tested by RDT or confirmed with PCR. The severe shortage for asymptomatic, the healthcare may continue their duty if they are able to. The symptomatic or confirmed by lab or symptomatic health care worker, the severe shortage, they will continue their duty if they are able to, and healthcare workers should adhere to universal mask during their duty. Affected healthcare workers should minimize their exposure to other colleagues as much as possible. Okay, when no shortage, 7 days have passed since their start. When moderate staff shortage, the 5 days. This for who symptomatic healthcare worker. The symptomatic healthcare worker confirmed by lab, 7 days also passed since the test was taken, and no symptom appear during the period. When moderate staff shortage, 5 days have passed since the test was taken. After COVID-19 clearance and return to work, healthcare workers should always wear a face mask. Until now, they are requesting for all to still wearing face mask for source control while in healthcare facility, self-monitoring for symptom, and seek re-evaluation for occupational health if respiratory symptom recur or worsen. Here the flow chart for confirmed COVID-19 healthcare worker also. The same we told in the schedule. The staff shortage, no or yes. When no, the symptomatic or asymptomatic. When yes, the level it's moderate or severe. It's the same also. Here 7 days when no shortage. both is 7 days. Here, when moderate 5 days. The severity, it may continue their duty. They are able. The reference CDC and MOH and Waqaya also, from Waqaya also. Thank you. You have any questions? Finally, alhamdulillah, we finish all our lectures today. And all the course, alhamdulillah. I hope you interest and there is information for you, inshallah. You have any questions, please? Thank you for all. Thank you, Abrazak. Thank you, Tariq. Thank you, Haya. Thank you, everybody. Thank you, all attendants. I hope our lecture is useful for all, inshallah. And good night, and God bless all. Assalamu alaikum. شكرا لكم كلكم. أتمنى أكون المحاضرات أفادتكم يعني إن شاء الله. السلام عليكم.